Dr. Reddy's hour, so that I can sleep another hour on Thursday.
Jealous.
Good. Not many of you. What's going on? An exam?
So if you can either test as early,
Okay.
help us out.
Okay, let's start with poultry diseases then. And you're not supposed to eat or drink.
Wait, what?
So, what I found is the best way to categorize poultry diseases into respiratory and non-respiratory. The respiratory diseases, they're pretty similar, some differences between them. There are some reportable diseases. 2017 list reportable diseases, although it can vary from state to another state. So it's always advisable to consult local state reportable diseases. But some diseases are certainly reportable everywhere. So among the respiratory, fowlpox, very important disease. Avian infectious bronchitis, Newcastle, avian influenza, infectious laryngotracheitis, and turkey rhinotracheitis. Among non-respiratory, there is a list of also important diseases, although most of them are controlled by vaccination. Okay, so the first disease is a disease that is familiar in all species, which is pox virus, avian pox. Now, in relation to the clinical symptom, there are usually three presentations. The most common are the skin lesions, skin representation, and what's called the wet form of pox. But also, in the severe cases, there is a systemic pox which causes lesions in the internal organs. As seen here, the scabs that are present, or nodules that are present in different places, and the comb and the wattles around the eye, and can be present everywhere else, in places where there is no feather or little feather. For example, around the cloaca region, under the wing, etc. The other form of the disease is the most lethal, and that's the wet form. And in wet form, usually it is an upper respiratory tract infection lesion, stroke lesion. As seen here is the caseous, if you want, appearance of the upper respiratory tract, or lesions in the upper respiratory tract, which can involve the trachea as well. So it's a serious disease, and it's a disease of chicken and turkey, rarely in pigeons, and not at all in canaries and ducks. In fact, there are three forms, but two forms are the most common. I mentioned the cutaneous, the wet form, and the systemic form. In relation to the cutaneous, it's similar to like in other species, which is the appearance of papules, which progress usually to scabs without this transition to pustules as seen in orf and sheep, for example. Now the scabs usually contain a number of particles, viral particles, and when they fall on the ground, if pulverized by movements of animals, it can spread the infection. Now, the infection can occur through arthropods, mechanical transmission. It can occur possibly by aerosols as well. Usually, like in other species, if the skin is lacerated, arthropods hover over the skin, transmit the virus to the lacerated skin animal and causes the infection. The infection usually stays locally, in case it is aerosol transmitted or skin, but can progress to a systemic infection. Now, the diphtheric form, as I said, is the most important and can involve membranes also of the mouth, the pharynx, the larynx, and sometimes the trachea. Now this shows the nodules that can be on parts of the animal, particularly in the, around the cloaca, and it shows the diphtheric membrane, sometimes called the pseudomembrane, in the area of the pharynx. And then it can involve the esophagus. So this is, if you want, pox, then it's respiratory and digestive as well. And in the esophagus, you see these multiple multifocal hyperplasia lesions. The diagnosis, the prognosis for the wet form is poor, very poor. Usually, the cutaneous form, unless it interferes with, for example, if it is around the eye and interferes with vision and things like this, usually animals recover from the cutaneous form. Whereas in the case of the wet form, due to the presence of the pseudomembrane, it causes asphyxiation and death as a result. Differential diagnosis, a number of conditions can cause similar lesions. Vitamin A deficiency can cause lesions similar to the wet form of the disease. And pantothenic acid, as well as biotin, both are B vitamins, vitamin Bs, they can cause similar skin lesions. Another disease is similar, which is Gully herpes virus disease. And the Gully virus herpes causes upper respiratory lesions similar to the upper respiratory lesions in the case of pox. So it should be differentiated, but Gully herpes is a herpes virus, so it can be easily differentiated using electron microscopy or, for example, PCR. In relation to the histology, the virus targets the epithelium, and the presence of intracytoplasmic inclusion bodies is characteristics of fowl pox. And here it shows the inclusion bodies in the cytoplasm. There are several types of vaccines: non-attenuated, attenuated, and recombinant. Usually the recombinant is another species, and like canary pox, and another virus like canary pox that is cloned to encode for proteins, which are pox proteins, so to protect against fowl pox. Non-attenuated and attenuated, the vaccines in poultry in general can be administered in water or through aerosol. In the case of pox, though skin scarification can be done, and usually the scabs that fell, if you want, on the ground, they can be picked up, ground, and the animal is skin scarified.
Dr. Nishar,
Yes.
you said they can be administered in water or which else?
Aerosol.
Okay.
Mhm. Another important disease, yes.
You also mentioned a systemic pox.
Mhm.
Is that the more severe form of
That's
what?
the most severe form, usually involve internal organs in general. There is no specific description of the lesions in these internal organs, but usually, it can lead to death eventually due to failure of these organs. But the most common presentation is a cutaneous animate form. The respiratory, another respiratory disease, very important, Newcastle disease. As seen here, the shape of the head is almost a square, an indication of edema in the head. The animal is gasping due to respiratory lesions. Green diarrhea, which is not really characteristic of, particularly of this disease, because green diarrhea can occur with other diseases. For example, salmonellosis can cause green diarrhea. And usually green diarrhea is as a result of pushing the intestinal contents very quickly. And the green color might be coming from the bile itself. A characteristic feature of this disease is the presence of hemorrhagic ventriculus. But it can involve also other organs. This virus is a paramyxovirus, and we know that paramyxovirus belonging to Paramyxoviridae family, and the family of these viruses, they cause respiratory and neurological symptoms. And this is a presentation of the neurological symptoms. One aspect of it is torticollis, pushing the head under the body, but also can be circling, can be convulsions, muscle spasm, and so on. Another presentation is drop in egg production. It can be severe drop in egg production, but also the quality of eggs is different. What's showing here on the left is a normal egg, which is laid by, normal eggs laid by, what I call them, brown layers, or layers that lay brown eggs. And this shows the white coloration, which is a discoloration of the normal egg, and it shows a thin, if you want, shell, which is an indication of lack of calcium in these eggs. So the discoloration is either is most likely the lack of the pigmentation, lack of deposit of pigment during the egg, if you want, a transition in the oviduct, and the lack of calcium, also deposition during the transition of the egg in the oviduct. Paramyxoviridae family, and there are 10 serotypes of avian paramyxovirus. And Newcastle disease is mostly caused by the Newcastle by avian pneumoencephalitis virus type 1. So there are 10s. The other types can cause also disease, but usually they are milder. Now, when it comes to The disease itself, it's endemic in other parts of the world. So when it comes to the US is free of Newcastle disease in chicken. However, Newcastle virus is present in wild birds, and particularly in the cormorants.
In the what?
Like what?
Yeah, cormorants. This one.
Come
How do you say? Cormorants?
Oh,
Cormorants.
okay.
Now this disease is monitored internationally by FAO organization and the OIE. The seriousness of the disease is because of high morbidity and mortality, very high, and particularly in a severe form of these viruses. This can be more severe if that depends on the strain of the virus, it depends on the environmental conditions and other conditions, and obviously whether the animals were vaccinated or not. Now the presentation, the clinical presentation can be confusing. For example, there are the asymptomatic, there's the type of the disease which is asymptomatic. It involves some enteric infection, lentogenic, which means it takes more time to develop, the disease takes more time, or the symptom take more time, usually involve mild respiratory disease. Mesogenic is in between, it involves respiratory and neurological, and virogenic, which is the most lethal. It can cause a neurotropic or viscerotropic symptoms or lesions. So to simplify this, it has been agreed that now one refer to these pathotypes only as virulent Newcastle pathotypes, virus pathotypes. This includes only the mesogenic, the virogenic, neurotropic, and virogenic visotropic. In the US, the disease is called exotic Newcastle disease. And that refers because the non-existence, if you want, of this disease in chicken, rather the presence of infection in wild birds. There has been an outbreak in California in 2002-2003, where 4 million birds were destroyed, and it costed $160 million due to Newcastle outbreak. So it's pretty serious, hence obviously it is a reportable disease. The neurological sign, I described them. It's the may include the muscle tremors, drooping of wings, dragging legs, twisting of the head and neck, circling, depression, or complete paralysis. The clinical sign, they're associated, obviously severity of the clinical sign depends on the type of the strain of the virus. There is, in terms of pathology, as seen here, the proventriculus is hemorrhagic. The intestine also is hemorrhagic. The trachea is also hemorrhagic. And the question was asked, is Newcastle disease a zoonotic disease? Because what we found is contact with birds that are infected with the Newcastle virus can cause conjunctivitis. Now, this is a mild conjunctivitis, they can eventually heal after a few days. Can be or can heal itself in a few days. So the answer to this is that it's not zoonotic proper, but it has, it is, if you want, mildly zoonotic. And there is no transmission from human to human. Now the control actually applies to all respiratory diseases, which is basically the disinfection of premises, the all in, all out, if you want, system, and control of mechanical carriers like human, mice, as well as insects, and obviously vaccination. Now, vaccination does not prevent viral infection. However, it reduces the symptoms dramatically. So usually mild respiratory symptoms are present in chicken that have the virus. Another respiratory disease, pretty similar, although this involves only the upper respiratory tract. This shows on the left the depression, which is more common, I mean, in all respiratory diseases. Birds are depressed. And gasping, which is again, gasping for air, which is again a sign of a respiratory infection. This is infectious bronchitis virus. Again, very important virus. And this is a coronavirus.